Hi folks, I am the Super Patriot. You may have noticed that I wear a mask and glasses like my associate, the anti-terrorist. This is not intended to copy his genre, but is done by necessity. When you go up against the police, the government, or organizations with power or money, you have to be anonymous. The easiest way to do this is with a disguise. I myself have been threatened by law enforcement for my work in reporting and helping prosecute police officers that break the law. This is also the easiest way to hide your identity. The police have programs to depixelate, deswirl, and bring out your image. They can find out who you are if they want to. Enough about that. Today's subject is about the healthcare industry. The 2008 election is addressing socialized healthcare. This will not work. The AMA will never allow the government to tell doctors that they are now government employees, or that their $1.5 million salaries are now gone, or what they can charge us for products or services. The AMA controls the healthcare industry. It is the wealthiest, most powerful lobbyist organization on the planet, bar none. The AMA could buy and sell Microsoft lock, stock, and barrel. They have an inside monopoly. They tell doctors, hospitals, and every other medical company what they can charge for products and services. They organize and dictate what training and educational requirements are needed for every medical position. The AMA negotiates with drug companies on how much of a kickback doctors are to receive for writing prescriptions, how much of a kickback doctors receive for ordering a patient's test, and how much to charge patients for every product and service the medical industry provides. Do you think they're going to allow members to be socialized? Can you name another industry where kickbacks won't land you in jail? The AMA represents a $1.8 trillion a year industry, the single largest industry in the world. By comparison, the Soviet Union collapsed under a $374 billion a year military budget. That's in US dollars. The US spends over one-third of the world's total expenditure on healthcare, more than any other nation. Because we spend the most on healthcare, you would think that we would have the best, wouldn't you? Well, we don't. Out of the top 90 industrialized nations in the world, we rank number 46, behind a lot of third world countries. When I say rank, you may ask, what am I measuring this by? Well, longevity, of course. How long we live. The average American lives to be 74 years of age. The average lifespan is higher in 45 other countries. Peru, Tibet, Okinawa, and Japan outlive us by decades. The average number of Americans that will live to be 100 years of age is 1 in 50,000. The average in other countries is 1 in 5,000. Some of you will argue that it's genetics. Well, do the math or ask a geneticist how and why that can't be the case. If it were genetics, then we would all have died out by now. That's a whole other subject. Getting back to the medicine, did you know that there is no law of ethics that states that a doctor has to cure you, even if a cure exists? If you need medication, there is no law that says that you will get the best one. Let's use drug A, B, and C. Drug A, well, is generic. It has no kickback and little side effects. Drug B, let's say, works okay, has lots of side effects and some kickback. And drug C works marginally, has massive side effects, and either gives a considerable kickback or is being pushed by the AMA, the FDA, or the insurance company. Guess which drug you're going to get? Drug C. There is no law of ethics that dictates that you should get one over the other. Do you know what the last disease cured was? Do you? Care to guess? It was polio, and that was in 1955. It was cured by a doctor who was now known for destroying an entire industry. Polio doctors, clinics, prosthesis companies, the ones that make leg braces, crutches, wheelchairs, as well as many others, were all put out of business or had to change what they did for a living. Did you know that the AMA purposely keeps the ratio of patients to doctors artificially high so the demand will remain high for medical professionals? Did you know that the AMA has many ailments declared as diseases as possible? Why do they do this? Because if something is declared a disease, then it has to be treated by a doctor, and prescriptions can be written for it. Right now in the country formerly known as the United States, the AMA and FDA want to regulate the sale of vitamins and minerals and homeopathic remedies so that you will have to go to a doctor and get a prescription. Why do we even go to doctors anyway? The average American lives to be 74 years of age. Guess how old the average doctor lives to be? 56 years of age, the shortest lifespan of any other educated professional. That comes directly from the New England Journal of Medicine. The Super Patriot does not make this stuff up. That's right, we're going to seek advice from people we will outlive for our own longevity, let alone the fact that doctors kill perfectly healthy people at the rate of 300,000 each year. 1.5 million people die each year in the U.S. from mistakes made by medical professionals. 2 million contract a disease or infection while in the hospital. A disease or infection that is more serious than the problem that put them there in the first place. And 90,000 of these patients will die each year. Doctors have been officially declared the third leading cause of death in the United States. Doctors are also responsible for 75% of all insurance fraud claims. That's $50 billion each year falsely filed with your insurance company. That comes from USA Today. Once again, Super Patriot does not make this stuff up. American consumers pay $1,600 on every auto purchased just to cover health care costs. I believe Barack Obama wants to investigate insurance companies for the rising cost of health care. Nice try, but that's like investigating the morgue on the rising number of murders. Each American pays $300 for every man, woman, and child each year to cover the medical industry's insurance fraud claims. For a family of 4, that's $1,200 each year out of your pocket to cover a doctor's crime that brings you no benefit at all. ABC News reports January 29, 2007, automakers are spending $12 billion each year on health care costs. Of the big three, GM spends $5.3 billion, Ford $3.5 billion, and Chrysler $1.9 billion. GM pays for one medical procedure every second of every day and a prescription every 2 seconds of every day. This payout includes 500,000 doctors, 35,000 pharmacies, 5,000 hospitals, 120 HMOs, 80 insurance companies, and Ford is closing 14 auto plants and laying off 30,000 employees. They are losing 8% of their market share. Asian auto companies are picking up 5%, and European companies are gaining 3% of the market, while only paying 10% of what American companies pay for health care. ABC News releases healthcare cost is destroying American industries. Well, folks, thanks for listening. Look for part 2, which will be coming out soon, right around or just after the 2008 presidential election. In the words of my associate, the anti-terrorists, let's keep the conversation going. Let's all get involved. We're all in this together. Thanks for listening.